As a pharmacist, you are the final checkpoint. A single overlooked lab value or drug interaction can drive a patient with impaired renal function into acute systemic toxicity. Even a simple misunderstanding about how to use a medication can be lethal. Leaving an old patch on while applying a new one leads straight to a critical overdose. In the next few minutes, we are going to run through 9 distinct high-stakes clinical scenarios. These are the situations you need to recognize instantly to build your clinical reflexes. Trusting your gut isn't enough when lives are on the line. You need strict, objective rules to know exactly when to educate the patient and when to completely halt the dispensing process. First scenario. You receive a prescription for high-dose vancomycin. The patient is an 80-year-old male with severe renal impairment, showing creatinine clearance around 22 milliliters per minute. This is a strict stop. You must hold dispensing immediately and call the prescriber to verify the dose. Scenario 2. A patient with rheumatoid arthritis presents a methotrexate prescription taking 1 tablet daily. This is a high alert error. Methotrexate is strictly a once-weekly drug. A daily dose is highly toxic. Halt the process and clarify this error with the prescriber right away. When this prescription is corrected, remember to counsel the patient on folic acid supplementation. It reduces methotrexate side effects. They should take it daily, except on their specific methotrexate day. The takeaway here is that for systemic, high-alert drugs involving impaired organ clearance or strict dosing frequencies, your duty is an absolute system stop. Now for devices. If a patient exhales into a dry powder inhaler before using it, moisture enters the chamber. This causes the medication particles to clump up, blocking airflow and preventing the drug from reaching their lungs. With liquid pre-filled pens like Trulicity, explicitly tell patients, do not shake it. Instead, press the button, hold the device against the skin, and wait 5 to 10 seconds until they hear a distinct second click. Shifting to transdermal delivery, environmental exposure is a major hazard. If a patient applies a fentanyl patch and uses external heat sources like heating pads or hot baths, heat increases blood flow and drug absorption, causing a fatal overdose. If a duplicate patch is discovered on a patient, immediately remove both patches completely. Taking off the adhesive isn't enough. Instruct them to wash the skin thoroughly. A drug reservoir remains trapped in the skin's lipid layer and continues to absorb. With transdermal systems and specific devices, successful treatment relies on physical handling and environment. Mechanical education is exactly as critical as chemical verification. Consider this active recall scenario. How do you advise a patient attempting to use a sticky, melting glycerin suppository in the middle of a hot summer? Harden the medication first, using refrigeration or cold water. Explicitly warn against using warm water or microwaves, which destroy the suppository. To properly insert it, instruct the patient to lie on their left side, bringing their right knee up toward their chest. For vaginal pessaries, gravity is the main factor. Counsel the patient to maximize retention by inserting at bedtime and staying lying down. You must also explicitly warn them to never douche after insertion. This physically washes the medication out and causes treatment to fail. Ultimately, intimate administration routes demand highly specific patient counseling. You must actively address gravity, temperature states, and bodily positioning to prevent complete treatment failure. We can consolidate these scenarios into a 4-part mental checklist. Quadrant 1. Recognize high alert stops like kidney impairment or dangerous frequencies. Quadrant 2. Manage patch hazards like heat and duplicate washing. Quadrant 3. Check device mechanics for moisture and shaking rules. And Quadrant 4. Confirm temperature and bedtime rules for intimate routes. Expert counseling focuses on anticipating the specific mechanical and behavioral mistakes a patient is likely to make before they leave the pharmacy. Internalizing these red flags positions the pharmacist as the final, active barrier between a clerical oversight and a clinical catastrophe. So keep this checklist close and always protect your patients.